mic bi boy xam nga fi la ñoo dégg gaay lu ñoo wax lii taalu de Hello viewers, welcome again to another special edition on the update of the, of course, situation of the coronavirus in the Gambia. As you know, every day we bring you live updates as it happens from the Minister of Health. And of course, today we are back again, Friday, the 27th of March 2020, to look at the situation of the coronavirus in the country. So of course, it's good to have you again on this, of course, special edition. Today, of course, again, of course, the venue has been moved from the Central Medical Stores in Kotu to the ministry in Banjul. Our team is on the ground to give us updates on the situation. Of course, you know, the time was said is going to be 3:30 local time, or 2:30, but I think that has also changed today. So what's new? We're going to find out from our team in a moment in Banjul. But before that, though, I am glad to say joining me this afternoon on the platform is Fatou Jaumane, former activist and journalist, so we can, you know, briefly discuss on the situation of the coronavirus in the Gambia, and of course at the same time then later on discuss on the latest update from the Ministry of Health on the, of course, situation both, of course, regionally and nationally as far as the COVID-19, you know, issues are concerned in the Gambia. And Ibrahim Presba is also standing by on the ground, like I said. We would in a moment, of course, go live to hear from him. Fatou, good afternoon, and thank you very much for joining us today, and it's a pleasure to have you on this platform to discuss on the situation of the coronavirus in the country as the ministry is about to go, of course, to update Gambians on the latest situation of the disease.
Good afternoon, Ibrahim and Africa. I'm glad to be here to join you today on this very important discussions.
Thank you. Of course, I probably need to tell you, I am Amadou. Ibrahima is standing by, but it's all the same. Ibrahima, good afternoon to you. Of course, we would want to know what is the latest developments, what is the situation on the ground at the ministry in Banjul at the moment?
Yeah, good afternoon, Amadou, and good afternoon, all the viewers right now. So actually, we are in the capital city, Banjul, and we managed to do the usual thing, that is to go to one direction, and only to be told that the press conference is being moved to another location. So as we were initially at Kotu, you know, medical store, but right now we managed to be at Banjul. I'm currently waiting for the press conference to start any minute from now.
That it will start any time from now, and I was going to ask because the time was initially scheduled at 2:30. Did you know why the delay yet again? They promised that they would be respecting the time, but another delay happened today as well.
Yeah, this is about the third time that the ministry would tell us one thing and they go ahead to do the other thing, and I think we are getting used to it, and actually it is becoming a tradition to keep shifting from 1 minute to the next. We have not been told any reason as to why the venue is not Kotu today, but Banjul. But however, usually whenever we come to Banjul, it is the minister who is likely or who must be the one to speak to the press. When it is at the Kotu, is the Director of Health Promotion and Education who will be facing the press. But today, as far as it is in the Banjul, the capital city, so the minister is understandably indoors, so on a brief session with his technical team, which is also one of the routine, activities for the ministry. Every time before they face the press, they have their technical team to, assemble reports and then confirm what to tell the media.
As we are about to hear from the minister, hopefully soon, what are we to expect today from the briefing?
Yeah, so a lot is expected, especially with regards to the number of coronavirus confirmed cases. So far, it is 3 in the Gambia, according to the Ministry of Health. But as of yesterday's press conference, we were informed that one, case was pending. One of the test results was pending, which is expected today. That test is in connection to one of the primary contacts of the late Bangladeshi who died on Sunday. He happened to be the second confirmed case in the Gambia. That was the case. The primary contact to that late gentleman is the one who was tested. Initial report said he was positive, and then confirmatory reports, according to lab technician yesterday, said he tested negative. So he was subjected to a second test. So what will this second test communicate to the Gambia is definitely today for the media to know from the minister. Away from that, also, as we know that the minister has been promising to strengthen health facilities. Especially after the cabinet of the president Adama Barrow approved $500 million to be used for corona response, the response to disease. What has been done so far? These are all questions that the media think we will have to hear from the Ministry of Health.
All right. We also understand earlier today the Gambia Press Union leadership was at the ministry to talk on or to discuss on matters of the safety of journalists. What more can you tell us about that?
Exactly. So a few minutes ago, I managed to speak with the Secretary General of the Gambia Press Union, Sekou Jammeh, who confirmed this, that the Gambia Press Union has been concerned about the safety of journalists. As you could remember that all the previous press conferences that have been taking place under the ministry, the journalists are subjected to a very close contact among themselves. So this is a moment for social distancing. But why are journalists not able to create that space? But we are hosted by the Ministry of Health. We should have facilitated that. Away from that also, there are no materials that is coming from the government as to disinfectants and then hand sanitizers, at least to give to people, with exception of the hand washing protocols at the entrance of the ministry for the press conference. There has nothing been coming to the journalists. And I think we as people covering in the front line for this coronavirus outbreak in the Gambia, it became a concern for the Gambia Press Union to engage the minister. And not only that, also they encourage the minister to be more frank as to what is being done, what is happening in the Gambia. At regular press conferences, he himself should be taking the mantle of leadership to talk to the press, not just to delegate all the time. So these are all issues that the press union is working on to give detail to the public to know what were the issues they engaged the minister on earlier on today.
Well, I think that's a very good step from the Gambia Press Union. Now, you earlier on mentioned about support, and you have been closely following, of course, the developments and, of course, monitoring how the development has been unfolding in the country. Now, do we know at this point the 500 million approved by the president has been given to the ministry to support its activities on the situation of the country?
In fact, before the approval of $500 million for the corona response by the cabinet, President Adama Barrow made a statement where he encouraged the Minister of Finance to dispense funds in response to the corona pandemic. So, but since then, there are no noticeable, in situations where one can tell where the money is going. So I think, we would have expected that maybe health facilities are strengthened according to the promise of the minister in a previous press conference, and then maybe there is another testing ground other than the only place in MRC in Fajara, for example. So quarantine centers also are limited within the Serekunda here, and then you find people complaining, they are complaining of the conditions of the quarantine center. Nurses are complaining of lack of materials to address the situation, since they are the contact persons, patients, whoever is to be quarantined has to have close contact with them. So actually, there is no indication as to where the money is going, if it has started going somewhere.
speak how soon the briefing would start, in 5 minutes, 10 minutes, or 30 minutes time. Can you tell us?
Yeah, anytime from now, because right now the director of health promotion just arrived. Minister actually, he did his office.
All right.
For the directorate and the Ministry of Health, Modufal and Salif Toure are all here. So anytime from now, the press conference might start.
Will allow you to keep monitoring your eyes and ears on the ground. Many thanks, Ibrahima, for now, and I will engage Fatu on, of course, what you have just updated us whilst we wait for the commencement of the briefing.
Thank you very much.
Right, thank you. Ibrahima Prespa, live in Banjul at the Ministry of Health, where, of course, the press briefing is about to take place and update the Gambia on the situation of the coronavirus in the Gambia. Fatu, we just heard from Ibrahima, but first I will ask you, what is your reading on the situation of the coronavirus in the country?
We are all aware of what's going on around the world, Gambia included, and we will have to take this seriously, the government and also the community. We will have to all act swiftly. No need to panic or fear, but we will have to be very cautious. You know, get updates on the issues that are going on. Make sure we follow all instructions and advice from our health authorities in the country and around the world.
Well, this is a new sort of development that hit the wall, the coronavirus and all that. But are you satisfied with the kind of position government have taken to approach in dealing with the coronavirus disease so far in the Gambia?
Not really, but anything that has to do with government, whether it's in the Gambia or around the world, it doesn't move quickly as it is supposed to be. Gambia government included. I think they will have to take this seriously and take swift actions to help all necessary, whether it's departments, health workers around the country. Just as you said, the GPU is concerned about the journalists who are covering these issues, health centers around the country, security personnel. It's very important that help reaches them quickly.
Do you have any other concern with regards to maybe how the Gambian people are also approaching this disease in their dealings and way of life? Excuse me. Do you have any concern about that?
Yes, yes. It's important that we take this pandemic seriously. We have to reduce our interactions, social distancing, as we call it. We will have to be very, very careful. Because as I leave my place, I've seen kids playing soccer as it's a normal day. It's not. That's why they are out of school. They are out of school to stay out of congregations and gatherings. So their parents should do more. We should do more talking to our neighbors, our communities, to tell them this is a very serious thing that we will have to take seriously.
In this, I was going to say, parents also have a big role to play in keeping their kids home.
Big role.
Busy,
yes, keep them busy and keep them from roaming around the streets as they normally do, or playing soccer around the streets. Just until we know how to tackle this issue around the world. We just have to be patient. It's not easy, but we will have to.
3 cases so far confirmed in the Gambia, and I know you have been monitoring development in other countries. For instance, what is happening in Italy, of course, Spain, and other countries in Europe and America. What's your view on that as well? Globally, the impact of coronavirus. Somehow, some way, it looks worrisome, one can say.
Yes, very worrisome. But the West, they are doing all the necessary steps that they need to take to tackle the issue. Italy is calling for help. We see Cuban doctors, arrive trying to help them. America, China, they're all trying to curb this. So in Africa, we are going to do the same. And we're not even as prepared as the West. So you can imagine. So that's why we are going to be more cautious than other folks or people in the West, because we don't have we don't even have test centers here.
Yeah.
I think it's only one, as far as I know.
Very few, though.
Very few.
Yeah, absolutely.
You know,
Yeah.
very few, and up to now, all these health centers around the world, around the country,
Yeah.
I'm not sure whether they have all the necessary precautions and things to help them.
The director was yesterday talking about that, as Ibrahim earlier on mentioned, strengthening health facilities around the country so they can have tests as required, you know. But then I was also going to ask, what can we learn from those countries who are highly hit at the moment? Probably we are not at the same level, but you cannot tell because you cannot. No one knows what the future holds as far as this virus is concerned.
No, this is a pandemic. It's very worrisome.
Yeah.
It's all over the world. Just as I said, we just have to be very cautious, take all precautions, work together. One thing that it is positive out of this, it's making us, you know, aware of each other's situation.
Yeah.
We are monitoring, we are talking, whether it's over the phone or online.
Yeah.
We are very. This is humanity. It makes us closer, even though physically we're not.
Yeah.
We all realize that when a pandemic strikes, we are all vulnerable as human beings. It doesn't matter what your title is, whether you're a doctor or politician or student or poor farmer, we're all dealing with the same scary situation. So it also helps people. I can see people are taking more care, you know, we are more caring for each other, you know, talking to each other.
More solidarity.
More solidarity,
Yeah,
yes.
Absolutely. Well, if you're just joining us, of course, it's your usual daily updates as we are about to hear from the Minister of Health. Of course, a special edition, as always, Africa bring for you. And we are hoping to go back to Banjul, to the Minister of Health, to hear from the health authorities and what is the latest, you know, on the of course situation of the virus in the country. Well, I know probably we'll just go. We'll end it here for now, Fatu, and then hopefully come back after the press briefing. What will be your message to Gambians as we wait to hear, and then probably.
I think the government has to act very quickly. If 500 million is approved, and we have to see action, more action. We have to see swift action regarding the situation. I'm sure the health ministry, whether the director or the minister, they're taking their time. But this is not about policy studies for now. This is about swift action. It's a crisis, and we have to manage it very, very well. So we cannot say there's no resources. If they approve 500 million, then I think that should help all authorities to take this thing seriously and move quickly.
All right. I know, of course, the government officials might be listening, and of course especially to the Minister of Health, and then we'll see what happens and in next possible days, weeks or whatever, but we'll end here for now. But of course do not go far. The ministry or the minister or whosoever is going to brief the media would probably come soon, and of course update Gambians on the latest update on the coronavirus situation in the Gambia. Of course, I hope we'll be back with Fatu so we can of course digest together on what is the latest situation of the coronavirus as we hear from the ministry. But for now, thank you very much, and of course till we see you soon. Thank you.